Two people, two horrific tragedies in the same week. First, Iryna Zarutska, followed by Charlie Kirk, both of whom suffered devastating neck injuries. My thoughts and prayers go out to them and their entire families as they deal with this unimaginable, senseless loss. Let's see what we can learn from these injuries from a trauma standpoint. My name is John Parente, and I'm a board-certified emergency medicine physician, and I've taken care of a lot of patients with devastating neck injuries in my career. In the emergency room, we label neck injuries as zones 1, 2, and 3. It helps us classify where the injuries are and what structures could be injured. But make no mistake, any sort of penetrating trauma to the neck is devastating. When we talk about penetrating injuries to the neck, we're talking about something that penetrates the skin and the soft tissue structures beneath the skin, which happened to both Charlie and Iryna, one from knife, one from bullet, obviously. These types of injuries can be catastrophic within seconds, not minutes. In this picture, you can see the big killers, the vasculature, the carotid artery, and the jugular vein, as depicted here. If either one of these is severed, or God forbid both, which is likely the case in Charlie's case, this can be fatal within seconds. The amount of blood loss that happens in that first few moments is critical. In fact, it's likely that neither one of these patients made it to a hospital with a pulse. As you can see in this diagram, it's not just the blood vessels. Other structures are very important. The muscles, the nerves, the esophagus, which is what we eat through, the trachea, that thing that we kind of need to breathe, and then of course the C-spine, which protects the spinal cord. Now normally with bad vascular trauma to like an arm or a leg, we do use a tourniquet, which can save someone's life. But in this situation, you can't put a tourniquet around somebody's neck. You compromise the airway, you also compromise blood flow to the brain. It makes these types of injuries extraordinarily difficult to handle. That's why penetrating trauma to the neck has such a high mortality rate. There's a reason why we say go for the jugular. These are such senseless tragedies. God bless the families of both Iryna and Charlie as they deal with this loss. If you want to learn more about how the ER handles these difficult cases and these difficult traumas, follow along. Sometimes education is the only way to bring any sort of meaning to this senseless tragedy.